Imbed Biosciences is advancing the paradigm of wound care with the one and only matrix that is fully synthetic, antimicrobial, and biocompatible. SAM Antimicrobial Technology. The platform technology of Imbed's full portfolio, SAM, integrates multiple wound care agents into a single matrix, delivering a one-product solution with multiple advantages across the wound healing process. A porous matrix of resorbable polymers designed to mimic human ECM, SAM conforms to the microtextures of the wound, facilitating a cytophilic, moist wound healing environment. No thicker than a human hair, this multi-layer polymeric matrix has a surface coating architecture that's optimized to contain evenly distributed metallic and ionic silver to deliver sustained antimicrobial action. Under the supervision of a healthcare professional, SAM is indicated for the management of both chronic and acute wound types, including ulcer, surgical, traumatic, and burn wounds. SAM can be used at the onset of wound treatment following debridement or in surgery and incorporated into the standard protocol of care. SAM may be cut to fit over any size and shape of wound. For large wounds or irregularly shaped wounds, it may be tiled across the wound bed surface. The matrix should be cut to a size slightly larger than the wound to overlap the wound edges. Apply SAM directly to a moist wound bed. If the wound is dry, use moist gauze and apply light pressure to the matrix in the wound bed to achieve maximum conformity to the wound bed and edges. When it comes in contact with the moist wound surface, SAM absorbs wound fluid and rapidly transforms into a biocompatible, cytophilic, non-pyrogenic soft matrix, creating a moist, wound healing environment that also has an ideal structural architecture to allow for cell proliferation. We call this the SAM scaffolding effect. The ultra-thin composition of SAM technology allows the matrix to conform to the micro-contours of a wound bed, providing contact with microbes on the tissue surface. SAM contains ionic and metallic silver at a low, non-toxic level, providing 99.99% reduction in microbial burden, including those microbes most frequently associated with wound infections, such as MRSA, staph, VRE, and yeast. Sustained antimicrobial activity of SAM matrix has been demonstrated for up to 72 hours in simulated wound fluid. It is not necessary to remove residual SAM matrix observed during dressing changes. A new matrix can be reapplied when clinically indicated as per standard protocol of care for the wound type. Duration of treatment with SAM depends on wound type and healing conditions. SAM Antimicrobial Technology.